Hi, everyone. Thank you so much for joining us for yet another edition of Adam Interviews, where we are talking to some of the more impactful people in our area. And this includes those in our healthcare industry, especially those on the ground floor, helping those in need. And with that, our guest today is Dr. Bill Valenti, the co-founder of Trillium Health. Bill, thank you so much for joining us. We really appreciate it. So we're talking today because you are going to be changing your role. I know you resist the R word, so we won't say it, but you are going to be taking on a different role. And before we get into what you've done, why don't we talk about what's happening now?
Well, this is the next phase of my career. I've been chasing viruses and doing infectious diseases for over 50 years now. I'm going to continue to do that, but in a different capacity, but stepping down from my roles at Trillium, overseeing programs, and also stopping patient care. First time in all these 50. So some changes coming, looking forward to having some time to think. Tell the story of HIV in modern era terms and get that out there, because I think that's important in terms of understanding how public health works, especially the history of HIV, and then taking a little time to think and travel.
Much deserved, to be sure. How did this all, so we talked about kind of where you're going. Why don't we talk about how this all began? It wasn't called Trillium initially.
No, we were called Community Health Network. And Community Health Network, CHN, was founded in 1989 in response to the AIDS epidemic. It was 8 years into the AIDS crisis, and a part of the movement at the time was to make more health care available to people with HIV and AIDS, and to do it in the community. So we started what became CHN, that's now Trillium Health, in 1989 during the height of the AIDS epidemic, and filled a considerable and a significant need in the community, because the number of cases in the area was doubling over time, and the local health authorities thought that we needed more capacity in terms of taking care of patients. So that's how it came about. And I would also note that it came about at a time when we were just getting started with drugs to treat HIV/AIDS, because for the first 7 years of the AIDS epidemic, there were no specific drugs like we have today.
Tell me about your path. Where did you come from? The reason I want you to get into this, because I want to find out about the road that took you to this point, where your passion came from. But to do that, I really want to start from the beginning, where you grew up and the education and experiences that you had before the AIDS epidemic even appeared.
I grew up in Rochester, New York. I'm a Rochester native, born here, on a street in the 14th Ward called Woodward Street, and lived there for the first 7 years, or the first 11 years of my life. A couple influencers. One was my mother's uncle, my great uncle, was an internist, an internal medicine doc in the neighborhood. And his office was on North Union Street. Dr. Jim Chiapetta was my great uncle. And I used to spend time in his office opening the mail. I was allowed to open the mail. And I was exposed to the Journal of the American Medical Association at a very early age. I didn't know what was going on when I opened the pages, but I knew there was enough going on there that I wanted to be involved in. I also grew up during the polio epidemic. So my first exposure to epidemics was polio. And kids in my class where did they go? They contracted polio and were going to a rehab school, city school district, and we're not coming back to my home school.
That's terrifying.
At the same time, here's the vaccine story, was the Salk, the original polio vaccine trials started. My sister and I participated in those trials, and received live vaccine and not placebo. And over the course of the next year or two, I watched polio disappear. There were no more kids in my school who ended up at School 5, the rehab school for polio survivors. So I lived through that. And that made a huge, huge imprint in terms of how I viewed the world, how I viewed science and medicine. The two of them, my great uncle, in his practice, and watching him, and Salk vaccine trials, and what happened with polio, brought me to where I am today, still chasing viruses after all this.
That is fascinating. You saw the direct impact of science through medicine, through vaccines.
It worked. The vaccine worked. I remember headlines in the morning newspaper that said Salk works. And that was the beginning of the vaccine era as I know it. That was a long time ago.
Yeah. So where did you end up going to medical school?
Wisconsin, Medical College of Wisconsin. Left Rochester for a while.
Yeah.
Came back here, did postdoctoral work here, including my infectious diseases, right here at the University of Rochester.
What made you decide? I mean, Wisconsin's a beautiful place. What made you decide to come home?
Home is home.
Yeah, I hear you. I hear.
Is always home.
So when did you? So all right, where were you when the HIV epidemic broke out? What were you doing at the time?
I was a young, green infectious diseases physician at the University of Rochester. I was on the faculty at that point, and I was doing what we call hospital infection prevention. I was like the hospital disease detective in terms of looking at infections that were trying to prevent any infection transmitted within healthcare within the hospital. The job was called hospital epidemiologist. It was very early in that aspect, that era of public health in terms of healthcare infection prevention. That's what I did, and I started the program there. The thing that I remember is that I was very green and really learned the ropes, learned as I went along. I had two experienced nurses who worked with me. I also had the good fortune of working within the infectious diseases unit at the University of Rochester, which was heavily virus oriented. That every one of my faculty colleagues had some subspecialty interest in a major virus. So I watched the development of RSV vaccine. Influenza vaccines were a big part of what we did. So it was very heavily vaccine oriented. So one of the things that we did was we described how viruses are transmitted in healthcare, which was new at the time. Somebody once called that groundbreaking in terms of describing what really hadn't been described before. So infectious diseases is kind of an interesting discipline of public health where there's a lot of problem solving and putting the pieces together of puzzles, looking at signals, that kind of thing, trying to figure it out that way. So we deal with puzzles.
When did the HIV puzzle first present itself to you? Was there a case that just confused you? Do you remember the moment where you go, there's something interesting or perhaps frightening happening here?
June 5th, 1981, Centers for Disease Control published a weekly bulletin of interesting issues and cases. And they presented 5 cases of what we now know as AIDS, but of this mysterious pneumonia that we see in AIDS from UCLA. And as it turned out, the physician who reported those cases was Dr. Mike Gottlieb, who had been my medical student.
Wow.
several years earlier.
Wow.
So I called Gottlieb on the phone. We talked about what was said, that we really hadn't seen any of this here. And he said, and if I were you, I'd get ready. And a month later, that's when it all changed. That's when we saw the first. In 1981, came into the emergency room at Strong Hospital, and then it was as though an avalanche had hit, because there were many, many more, and we were seeing what people were seeing all over the U.S. and globally in terms of this new disease that we hadn't seen before, that made people sick and killed them.
And at that time, there was a lot of fear and confusion because people didn't know how it spread, what it did. There was kind of like the start of COVID, yet you pressed on. You were still with patients and whatnot. What was going through your mind at the time?
Well, I did what I was trained to do, which was to look for patterns of illness and any kind of science, any little thread of science here that might help figure this out. And it was clear almost from the beginning that this disease had a pattern that was very similar to hepatitis, which is transmitted by sex, drugs, and needles. So there didn't appear to be anything that was transmitted contagious through the air. So we worked with that as sort of the underpinning of what we were doing, and were able to see patients efficiently. But at the same time, as you said earlier, even with COVID, we had that same experience where the contagion thing is a big piece of it, in terms of, well, just how is this transmitted? Am I at risk? Is my family at risk? Am I going to bring this home? I remember during the COVID period, I still hadn't gotten over my contagion piece thoroughly, when I know people who would leave the mail outside overnight just in case, and then bring it in the next day. So the uncertainty around contagion was a very big piece. Yes.
Yeah, there's no question. And you and I last spoke when Jim Callan died, the Spiritus Christi priest, who was also very involved in the HIV community. What was it like to be part of the very small group advocating for victims while there was a lot of hostility out there and fear when it came to HIV/AIDS?
Well, if you put the pieces together, there was a message there that we could give to people. It was a matter of making it understandable. But, when you know the facts, you have to at least present them to people to help educate them, so that you can make this whole thing better for other patients who are going to be coming along later. So the education piece, setting an example, and that's what Callan did. Father Callan was a role model for people of faith. And we needed that. And that's one of the things that's interesting and unique about this whole experience is the community involvement. That people all over this community wanted to get involved somehow, whether you were a healthcare person of faith from the faith community, or somebody who just wanted to have a fundraiser, make a donation, or volunteer their time with patients. People came together, did it.
So what do you think now that you can contract HIV and almost not feel the presentation of it, that medicine has come so far that you have some people, not saying the word cure, but we just don't see it as the monster that it once was in the community. What do you think about the evolution of that medical approach that led to this?
Well, that shows you what good science, that the progress that we've made with AIDS over the past 43 years is a direct result of the scientific community going to work and understanding, not only understanding this virus, but sort of applying it to making people's lives better with medication, the advocacy, other medical community coming together in terms of educating people regarding what you need to do to prevent HIV and bringing the two together. So the science community and the medical community come together. Everybody's pulling in the same direction, and look what you can accomplish. But you're right that the medication that's available today is almost 100% effective if taken correctly in terms of preventing HIV in people at risk. And we have pills and we have injections that do that. Same thing with treatment. So, but that's an example of 40 plus years of work here and huge investment, both private and public, in terms of we're going to go after this and do it.
Yeah. RFK Jr., running healthcare in the U.S. right now, has expressed skepticism of some of the vaccines that are out there and some of the scientific process that led to the vaccines and other treatments. What are your thoughts regarding his criticism and his, what's the right word, distrust of the system right now?
I was always told as a kid, do good for people. Don't mess up. And I kind of watched the mistrust in a high-level public figure, and it distresses me because of the impact that has. The fact is that there's enough science, and you have to understand the science, and you have to understand how to transmit, how to give people the message in understandable terms. But there's enough science out there that tells the real story. And my anecdote about the Salk vaccine trial is one of them. I can go to a higher level of science and tell it to you in a different way. But the fact is, it worked. And if you look at public health achievements over the past 100 years, vaccines play a tremendous role in terms of making people's lives better. Question is, how do you get around the conspiracy theories and the mistrust that goes along with that? One of the things I've learned is, and this has come to me in my later years, about respecting other people's opinions. You are entitled to it, to have these thoughts and these opinions, but please don't do harm to others as a result of it. And the signals that I see are a change in patterns of vaccination for children entering kindergarten, and that shows up as measles in young people. These measles epidemics don't just happen, they happen for a reason. And non-vaccination, for example, vaccination mistrust has consequences. And those are some of the consequences. It's the same experience that I had as a kid at 14 school, looking for my classmates who had disappeared and gone to 5 school for rehab. The signals were there. The vaccine changed all of it. And there's science to back that up. And every step of the way, we have enough science behind it to tell the real story. One of the problems is, and I'll take some of the hit for this, is that sometimes my explanation doesn't hit home in understandable terms. And that's an important thing for us to do. We're obligated as healthcare people to tell the message in terms that people.
Trillium has grown to the point that it's not even close to what it once was. There's a health component now that involves food. I've gotten the tour of the pantry there. Folks coming in and getting that. So we have a situation now where folks are either getting a partial benefit for SNAP or no benefit. It's very confusing right now. We're not sure. You, as I noted at the top of this conversation, are on the ground floor. What does life look like for a lot of people who get SNAP if suddenly they don't have the full benefit or the entire benefit? What does life look like for them?
Food is healthcare. That's all I can say. Is you have to. Healthcare is more than taking pills and going to the doctor's office and having your blood drawn. It's living the right way with the right life habits and food, housing. Those things are all important parts of healthcare. And when people don't have that, they suffer. They cut out taking medicines to buy food, make sacrifices that are detrimental to their health, those kinds of things. And I think it's important to remember it, to think of it just that way. That's a real simple message. Food is healthcare. And without it, you're impacting people's health.
Where do you hope things go from here regarding SNAP and the shutdown? What do you foresee happening? What do you hope happens?
Well, I think what will happen is we will eventually reach a common ground where we don't fight cultural and political battles around people's health and food. That figure this out somehow. And I agree that the culture war is different than giving people health care and food. So I'm hoping that we will come to our senses and find common ground that makes sense, as opposed to fighting around people's health and doing harm to them. Because I go home to a full pantry, and a lot of people do, but there are other people who don't. And we need to recognize that and understand that and overcome our cultural differences in a way that has some meaning but doesn't hurt other people.
One aspect of health and healthcare that has gotten a lot of political attention is providing safe injection sites for those who take illicit drugs. And I think everyone agrees that, you want these people to live so eventually they can get the treatment they need and go into recovery and all that. At the same time, you have folks who say that these sites promote drug use. What has been your response to that over the years?
The science tells the story, and that is it reduces mortality, death, and also has a straighter shot into getting people into rehab. That it's a different kind of environment, and it's safer. That's why they call it safe injection sites. So they work. The problem is the cultural piece there, where we have our own set of biases around people who inject drugs or who are different than we are. But that's a mental illness that needs to be treated. It's like diabetes. We need to look at it that way. And if we don't, then we end up with getting confused and mixing healthcare, the importance of healthcare and how that works with cultural issues. And it gets in the way, and we are still dealing with and struggling with the idea of safe injection sites. I agree that culturally it's an issue, but at the same time it works.
Where do you hope Trillium Health goes from here? Obviously, you'll still be around. You'll be an influence. Your legacy will be part of the program, the organization. But at the same time, you are going to go traveling and other people are going to have commanding positions. Yes. Where do you hope it goes from here?
When we started the AIDS clinic all those years ago, Dr. Steve Scheibel, my partner in this, said, you know, if we get this right, we'll create a health organization that outlasts. So that's what I hope, is that it outlasts me and continues to do the kinds of things that we do. We'll take people regardless of ability to care, to pay, and nobody gets turned away. Keep doing it.
Dr. Valenti, I want to thank you so much for your help and for your work over the years to provide health care to the community, not just individuals, but the entire community. And I think that we are a better place for it. All right. Dr. Valenti talking with us today about his non-retirement retirement. We wish him very well on his travels. He has some great plans, perhaps hitting the road to see this beautiful country. And we want to thank you for watching once again as we continue to talk about the various people in our community who have dedicated their lives to making it a better place to live, whether that's through music, through business growth, and through healthcare, and so much more. So if you like what you've seen and heard today, please, of course, tell your friends and family about the Rochester First app. Obviously, we have the Adam Interviews segment every weekday at 8, but we are putting on more and more, whether it comes to eating and sports and weather and all that. We are going to provide the information and entertainment that you're looking for. So thank you once again, and thank you to Trillium Health for providing some time for Dr. Valenti to come in and talk with us today. All right, take care, everyone.
Get the Rochester First streaming app today for everything you love from News 8 on demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.